The COVID booster program is being extended to 16 and 17-year-olds. Let's bring in Leanne Wong in Melbourne and Michael Rennie in Brisbane. Leanne, kicking off with you, what do we know about this news?
Well, what we know is that from today, 16 and 17-year-olds will be able to receive their third vaccination dose at state-run hubs like the one right behind me, as well as GPs and pharmacies, provided it's been at least 3 months since their second dose. Now, that comes after ATAGI gave the green light overnight. And what that really means is that from this week, more than 60% of 16 and 17-year-olds will become eligible to receive their booster, which will have to be the Pfizer vaccine. Now, Federal Health Minister Greg Hunt has welcomed this announcement from ATAGI. He says that for students returning to their final years of school, hopefully that this decision that they're being able to receive a booster will help provide more stability and reassurance. It's also worth noting that for severely immunocompromised 16 and 17-year-olds, they'll also now be eligible to receive their fourth dose if it's been at least 3 months since their third dose. Now, so far, almost 90% of 16 and 17-year-olds have received 2 doses of a vaccine so far, and it's hoped those numbers will continue to rise.
Leanne, thank you. Michael, in Brisbane, the Queensland Health Minister is urging parents in Queensland to get their kids vaccinated as quickly as they can.
Yes, that's right, Michael. And the vaccination rates in Queensland for children, look, they're not where they would like them to be. The Chief Health Officer here, Dr. John Gerard. So if you look at the figures for the 12 to 15 age brackets, we're currently sitting at 75% first dose, 68% second dose. For children between 5 and 11, it's even less than that. Only 35% of children have had their first dose of the vaccine. And the concern is that when children do go back to school on Monday, we are going to see spread of COVID-19 in the schools. And it's not so much the children they're worried about, it's the parents and the grandparents. And if you look at the figures, it's definitely needs a bit of a boost. But we had 16 COVID-related deaths in Queensland yesterday, and tragically, one of those deaths was a child under the age of 10 with underlying health conditions, and 7 of the 16 people who died were also in aged care, Michael.
Michael and Leanne, thank you both.